Hey team, it's George here, and you may have seen the news coming out of America that Descovy has now been approved for the use of PrEP in men and in trans females. So what does this mean from an Australian perspective? To be honest, it's good news, but it's not really going to change much in here. So Descovy is very, very similar to the approved drug Truvada here in Australia for PrEP. The main thing is that it's a little bit more gentle on the kidneys. Now, it is important to be aware that Descovy is not currently approved for PrEP in Australia. So if you are a candidate for Descovy, and the main people that I would consider as a candidate for Descovy are people who are having issues with their kidneys when it comes to PrEP. So there is the possibility that with a doctor's prescription, you could import Descovy into Australia as an off-label medication to be used as PrEP. However, I think for the vast majority of people within Australia, Truvada, the approved medicine for daily PrEP, is very, very good. It's very, very effective. We know it works both taken on a daily basis and also taken as an intermittent basis. So from that perspective, I think within Australia, the idea of having a choice is exciting, and it's going to be good to be able to have options when it comes to a choice of medications for PrEP. However, I don't think this is a game changer at this exact point. If you do have issues with your kidneys that have prevented you from being able to go on to PrEP, this is an opportunity to talk with your doctor. So yeah, it's great news. However, I don't think it's a massive game changer in Australia at this exact point. However, for a small group of people, it could be a game changer, and there are options available, but those options would not be through the PBS system at this exact time. Of course, if you have questions, please have a talk with your doctor, have a talk with your PrEP prescriber about what may be good options for you. I hope that was helpful.